patient's office is this a treatment that's going to hurt? And the extractions that we do are pain-free and effective. And we have a picture of some really great extractions that we did on a patient's nose, and it shows how it really offered a lot of clarity, so that might pop up at some point. We do rehydrate the skin after we've done, those extractions. There's a product called Antiox that helps to really, isn't that awesome with those extractions there? That's immediately before we started the treatment and then immediately after before we put the sunscreen on. Pretty noticeable if you ask me. So then we rehydrate the skin with this wonderful antioxidant and peptide-rich serum. It goes all over the skin, really helps offer a beautiful glow. We work with some LED lights as well. The LED lights, we've got two different ones. There's the red LED that I like a lot, the red LED, Priya, if you want to show them. That one is kind of our, I guess, catch-all for, all the different treatments. The red LED helps to reduce inflammation in the skin. It does help to calm redness, and it does help to, over continual exposure, reduce pigmentation and, soften fine lines and wrinkles if we do this more regularly. The other LED light that we have is the blue light. Blue light, simply put, just kills that acne-causing bacteria in the skin. This is a great treatment that can really treat all skin types. If you're acneic, this can really help to offer a lot of clarity, because remember the extractions that are pain-free. And then this can help if you're looking to correct fine lines and wrinkles, if you're looking for, smoothing out the texture of your skin. This is a great way to kind of start the process of that. And we've got some really neat boosters that we can do with that treatment too. So again, if a person's looking to correct fine lines and wrinkles, one of the boosters that I absolutely adore is the Derma Builder booster. So if you've ever come in to see Dr. Gray or Shelley for injectables, and you get, Botox in your areas of expression, Derma Builder is a great way to complement that, because you apply it right to those areas of expression. So typically when I'm using it, I put it right around the crow's feet area. I like to put it through the forehead, right in those lines. And I sometimes like to work that in the nasolabial folds. And it really helps to soften that out. You put the red light right on top of that, and it's neat. We've got some really cool before and afters that we could show at some point too. There's no recovery. There is no downtime from a Hydrafacial treatment. You walk out of here perhaps a little rosy. That usually subsides pretty quickly, like maybe in an hour or so. So we talked a little bit about acne, and one of the things that I really want to drive home is the pain-free process of it. So if you want to walk up and show them the tip. So right there, oh, I'm so sorry.
Okay.
So the tip, if you look right inside the tip there's a little vortex. So throughout the whole process of the Hydrafacial treatment, that little vortex that you're seeing, there's a couple of different tips that we use, are driving product deeply into the skin. So that way when we get to the portion of extractions, that tip is moving pretty slowly over the T-zone area. So your skin's actually soft enough to where the pores can open up and release any of that congestion that's kind of at the top of the pore, and then feed in some of that, acne killing product right into the pore too. So the whole process, it's really pretty amazing. Someone asked a question about what booster we would offer for dry skin. So we offer 3 different boosters at our office, and I would recommend going with the growth factor booster for that one. So the growth factor really helps to feed in a lot of, growth factor, I always like to say, is compared to like your protein that you take in, and that helps to really heal the skin, because whenever people are suffering from dry skin, you think of the process of, putting in those healing products and properties, that's how you're going to get that really nice outcome. I really like the growth factor before and after pictures that I get with patients, because they really do see that nice hydrated, glow, stronger, strengthened look too. So that would be my recommendation there. The other thing that I like a lot is we offer, so we started talking a little bit about the boosters, we offer a few different perks too. So like, yes, one of the other things is we can treat specifically a treatment around the eyes, and then there's specifically a treatment that we do around the mouth, and those are literally called the Hydrafacial Eye Perk and the Hydrafacial Lip Perk. And that's a specific product that we can use to help really thoroughly cleanse around the eye area. And then it's driving in a lot of hydrating products. And it has this really neat cooling roller ball too. So what's neat about doing the perk is that you get to take that product home with you. And I do recommend throwing it in the refrigerator because that does help the cooling process of it, and that can help reduce puffiness. The product you take home with you is about half the vial, and you would just use that morning and night until you run out of it, and then it's time for your next Hydrafacial. And then the lip one, you know, similar process. The pen is, you know, operates similarly, where it's that little metal roller ball that goes right over the lip area. I do like to work right around those fine lines and wrinkles as well. And then you get a really nice hydrating balm that you use after the fact as well. Someone asked if Hydrafacial is safe for rosacea, and the answer is yes. The red LED light that we've got can really help to reduce that inflammation and calm a lot of that down. Depending on the level of rosacea, we might kind of do a combination with the blue light to kill that acne-causing bacteria, so we can kind of dance both of those lights all around the face. And I feel like when we're dealing with rosacea, really cleaning out the skin, so that way your skin can really take in a lot of the properties of the products that you're using at home. They'll just receive it a lot better, don't you think, Brianna? Yeah, okay. And then we've got a little, I guess, time-lapse video of a patient that's getting a bit of a treatment here, so you guys can kind of watch what it's like. Hydrafacial is a very well-tolerated treatment. Again, I say again that it's a very pain-free process.
Can you guys hear me?
So here we are doing a little application of,
anyone hear me?
Like the growth factor, because she's done a series of, you know, different treatments that we offer in this office, and this just helps, you know, the healing process for her too. That's what the red lights look like on the face. They don't hurt your eyes. They're well tolerated by the eyes. I do ask that you keep your eyes closed during the process.
What is the light for again?
So the red light helps to reduce inflammation and calm any redness in the skin. The blue light's really neat because, again, if you've got, you know, if you're dealing with a lot of acne and that's the whole purpose of you coming in for it, that's a great one to just kind of throw into the mix. I'll have some patients who, you know, I've even had a girl that worked at the front desk who had just had like a little area that just consistently broke out, and I just painted in the blue light, and like just hang out with this on your face for a little bit. That will help to calm a lot of that down. That covers the Hydrafacial. The treatment itself is anywhere from 30, maybe 45 minutes, just depending on how we customize it for you. And then as far as cost goes, Hydrafacials can start at about $200, and then just however we customize your treatment, we'll determine how that works out.
Okay, well, that's like a great summary. I think, you know, these Hydrafacials, what I love about them is that, again, it's kind of an instant gratification procedure, because I think you do get this hydration that's driven into the skin and you look better. Whoop, I'm getting feedback, sorry. Almost immediately, but it also is something that cumulatively can have an effect with the boosters, and especially with the boosters. I think, you know, these lighter types of procedures where you don't have downtime are so nice, where someone's trying to make kind of low, slow, gradual progress. I always say, you know, I think of these skin treatments almost like a therapeutic ladder, where at the very bottom rung of the ladder are your everyday skincare products and what you do day in, day out, because they make a difference, but it's, you know, there's no downtime, very low risk, you know, low cost, and, you know, but definite results if you do this over a longer period of time. And as you move up the ladder, the results get faster, but you might have more downtime, more cost, more expense. For instance, at the very top of the ladder, in my mind, is like a fully ablative CO2 laser, which is going to give you a fantastic result. But there's a lot of downtime with it. There's a lot of risk with it. There's a lot of cost associated. There's some pain. So, you know, you want to find these things in between too, that kind of lets you get the result you want. And but with an acceptable level of, say, downtime or cost or whatever. And also make sure that you're choosing the appropriate thing. If you don't have much pigmentation and much textural issue, why would you even pick a CO2 laser? You shouldn't, and you wouldn't. So we kind of try and help guide you. So, you know, this Hydrafacial or these lighter types of peels, which are, again, are no downtime procedures, but that you really do over a series, I think are fantastic little dip your toe in steps. And then, you know, moving on, you can go into maybe like a more aggressive peel. Like we'll talk a little bit about, I guess, next about the Perfect Derma Peel, where that's a unique medical grade peel with a lot of different exfoliating acids in them, such as trichloroacetic acid, kojic acid, like a retin-A type acid, a bunch of different things, antioxidants, especially glutathione is one of their specialty products. But these are just really effective ingredients that can give you outstanding results, even with just one treatment. You will have some downtime with it, obviously, and I'll let Kim and Bria kind of talk about that. But I think the advantage of this is for someone who's really wanted to see a little bit more results, or maybe they have bigger problems with their pigment or their texture. Is that kind of how you feel about that, guys?
So yeah, I mean, we, at our office, we offer a number of different chemical peels. So the Perfect Derma Peel is definitely our going gangbusters chemical peel. What I like about it is it does target everything in an aggressive manner. So that it has this wonderful blend of all these different ingredients. It's a TCA peel. It has kojic acid, retinoic acid, salicylic acid. It does have phenol. So if you've ever done the treatment and you have a little bit of that smell, that's what that's from, is the phenol. And then it has vitamin C and glutathione. So a lot of those ingredients are going to very directly target, if you're going after acne, it's going to target that and really offer a lot of result there. This combination is also really great for smoothing out fine lines and wrinkles. It's also an excellent combination if you're looking to treat any sort of pigmentation, whether it be from sun damage or if we're going after melasma. This is one of those treatments that's really going to get you a nice outcome on melasma without causing too much irritation. Of course, good things come with, a price, and the price is just a little bit of downtime. So I would say the downtime's about 7 days, would you say? Yeah, about 7 days for the Perfect Derma Peel. Your more aggressive peeling process is going to be between that 2 to 4 day period, and that's going to depend on how sensitive your skin is, how you react to it, and also if you prepped your skin for the peel too. And we'll go in a little bit on what the pre and the post prep process is for the Perfect Derma Peel. It's a really quick process in the office. You come in, we do like to take before and after pictures for it. And then the peel itself, we do cleanse the skin. We do prep with a little bit of alcohol just to make sure that the whole area is fully degreased. And then one of the things that I like to do, and there is a little demonstration video of how a chemical peel process goes, I like to put a little bit of a protectant. So here I'm putting Aquaphor on this patient in the little mucosal areas, like right here near the eyes, right under the nose right here, and in the corners of the nose, because those areas typically get pretty sensitive and dry. And then I like to put it all through the lips because the lip area is pretty reactive to these peels. This just helps to really protect the area. And then you'll kind of understand and appreciate why, because once you start peeling, you typically feel, if you're watching my mouth, it's all the area that's moving on your face the most. So when the peeling starts to happen, it's usually right around this area, right around the nose, and then it just works its way outwards. It's important to know that when you're peeling, you don't pick at the skin at all whatsoever. It has to come off on its own. But like I said, the more aggressive shedding and peeling is going to be over that 2 to 4 day period. As far as results, they're really some of the best results that you'll see from getting a chemical peel. There are a lot of very aggressive peels that I've worked with. The addition of some of these more aggressive ingredients with the phenol, with the glutathione, that kind of helps to really ramp up how you handle the peel, but also the results that we achieve with it. So whenever we're going after it, it'll depend on, again, what we're trying to correct with your skin. You need anywhere from 2 to 3 treatments, and then we'll probably have you come in, space them out about 4, maybe 6 weeks apart, again, just depending on what your needs are and where your skin is. Maintenance is not a question that we get a lot. Your maintenance with these peels, say maybe doing them 2 or 4 through the year, again, just depending on where your skin is, what we're trying to accomplish. And it doesn't always have to be the Perfect Derma Peel when we go over to maintenance. We've got a few different options that we can work with just to help maintain the great results that you would get from this peel.
Okay, let's look at some quick before and afters maybe of the Derma Peel really quickly, and then let's move on to just in the interest of time to the microneedling, where we can kind of focus more on texture. Can you show us some of those, Allison?
I don't have them. I don't have them.
Okay. All right.
Sorry.
That's okay. All right. So, you know, I will tell you that the
Oh,
perfect,
here we go.
Oh yeah, there's
So
some on
here-
the poster.
yeah, very difficult. I think at least for what I can see, it's hard to see. So, okay. So, well, I will tell you. So if you can imagine skin with pigment and now better pigment and skin with not as good texture, now better texture. And that's kind of what it does. And, you know, I think what is nice about the Perfect Derma Peel is you kind of are addressing, you can address some acne with that. You can address pigment with it. You can address some milder textural issues. And so, you know, as far as texture goes, a lot of times I find people really are frustrated with that. And microneedling, what we're going to talk about next, is a great way to really kind of focus on that. Also, even, you know, if you've got some milder acne scars or things like that, I think microneedling is a wonderful procedure. It's a fantastic collagen builder. So let's move on and talk about like microneedling, what that does and how that works.
So I love microneedling. What this is going to do is help, you know, again, like Dr. Grace said, help smooth the texture of the skin. It can correct fine lines and wrinkles. It can very beautifully correct any acne scarring in the skin too. So my go-to speech whenever I'm talking about microneedling is our bodies are amazing. And whenever we're wounded, our bodies know to heal itself. So what we're doing with microneedling is we've got a pen that has, I think it's about 14 microscopic needles that are going in and out of the treated area. So it's typically the face, but we can treat from the face down to the chest, and causing all of these microscopic needle wounds through the area. And I'll stop there and tell you that we know for this treatment because that sure does sound scary. When our skin is wounded, again, like I said, it's going to send this rush, this cascade of collagen, of elastin up to the surface of that skin to help really heal it. So that's why after you've had the treatment, the skin's really nice and tight. You have a really nice glowy look for the next several days and weeks after having had the treatment done. Immediately after having the treatment, you may look a little sunburned. If you went a little more aggressive, you might have a little bit more of a recovery look. But after that, sunburn look goes away in a couple of days, you really start to reap the benefits of it. I had microneedling done maybe about a year and a half ago, and came home, looked sunburned. My husband looked at me like I was crazy and was like, "Why do you do the things you do?" And then the next morning, he was like, "Your skin is really just glowing and it's shining and it looks great." And so I was like, "This is why I do the things I do." So as we said, this is a treatment that can really target, be more corrective for acne scarring and for deeper fine lines and wrinkles. If you have a scar that you've been encountered from, some sort of injury, or if you've had a surgical scar, that's something that we can help improve as well. And this is also just great as a rejuvenating treatment too. So you don't necessarily have to walk in here and require something completely corrective. This is just something you can do as a maintenance process. A lot of people ask, is this painful? If we don't numb for this treatment, perhaps, but fortunately we do offer a really great numbing blend that we apply all over the face and allow to soak in for about 20 to 30 minutes. And that makes the treatment incredibly tolerable. Typically we require or advise anywhere from about 4 treatments or more, just depending on what we're going after. And you can kind of space this out and do, your microneedling and maybe alternate it with some of the other services. People ask about what kind of post-care we require. And generally after you've done microneedling, really you want to keep your skin pretty bare for about 24 to 48 hours. After you've done it, we will apply a light serum afterwards. And then about 24 to 48 hours after you've had it done is when you can start to reintroduce some of your gentler products. Certainly not your retinol, certainly not your salicylic or glycolic acids. You want to use maybe a gentle creamy cleanser and just something that's really healing and hydrating on the skin for that time period thereafter.
Yeah, and I want to say too, I just had my microneedling done probably like a couple weeks ago, and you do start to see, I think, that little glow about maybe within 10 days or so. And, the pain factor, I am a huge baby. And so I found the whole, with the numbing, it really was not uncomfortable at all. And that's the big thing is like, I think all of the procedures we offer, that's something I'm super conscious of, I guess, maybe just from a from my own personal perspective, just because I don't like pain. I don't want to have to like have the big, you know, the pain pill to take to get me through a procedure. I don't want things that have a ton of risk or a ton of downtime. So we kind of focused all of our procedures that way. And microneedling, I think, just fits in great with the other procedures we do. And it's nice to have the variety, I think, to what Kim was saying, to be able to alternate and kind of mix in these different procedures. And, you know, there's no reason we can kind of help customize sometimes for our patients a strategy to kind of go through, you know, achieving your skincare, whatever your skincare goal is. And so, you know, it might be starting with maybe you start more aggressively with microneedling and then kind of taper down to some of the lighter procedures, or you might do it the other way around. Some people are dip your toe in kind of people. There's some nice before and afters from microneedling on the screen there. So you can do it, you know, someone had just asked if you can do it on your neck, and yeah, you can really do this procedure pretty much anywhere. So it's really nice, I think, for enhancing the texture.
I agree, and I do look. Oh, sorry, we're all singing. You know, treating the full face is obviously what a lot of people will walk in here to go after with microneedling. I especially like to encourage people to go ahead and proactively treat the neck, because again, you know, it can't hurt to go ahead and stimulate that collagen and elastin healing response in that area. But we can aggressively go after, you know, what we experience, maybe the necklace lines right down in this area. We can go and be a little more corrective right in there, and it'll just really help to smooth and open those back up and make it so they don't look quite as apparent.
Yeah, I agree. That's kind of where I did when I got treated, is I did do my neck as well. And it is a nice transition. I think it's important to remember as you do these procedures, and, you know, we focused a lot today on the face, but your face, neck, and chest are one cosmetic unit, and people perceive that as one. So you really want to make sure that what you're doing or how you're protecting your skin even is, you know, you're being conscious of your neck and chest too, because otherwise what happens is you end up with this differentiation between the quality of the skin of the face, and then the neck and chest just looks a little bit different. And that, you know, our brain picks up that face, neck, and chest as one area. And if your face looks great and your neck and chest looks not as good, you kind of go to the least common denominator. So I think it's really important to also, you know, make sure you are giving some love and attention to that area as well. You know, we're going to Monday actually do a deeper dive into products and what to do. And I think that, you know, for those of you who haven't signed up yet, please register for the noon Zoom on Monday. And we will be talking about the products and how to build a good skincare regimen, a good anti-aging regimen for the long term.
Dr. Gray, a patient just asked a question that I'd like to answer. They asked, how long does the treatment last? And you're usually in and out of here in about an hour. So as I said, you numb for anywhere from that 20 to 30-minute window. And then the treatment itself, you know, we don't need to prolong this longer than we need to. You gotta try to make it so it's a quick and easy process. So treatment itself is anywhere from 20 to 30 minutes, depending on whether or not we're including the neck. And then that's it, you just go about your day.
Yeah, that is great. Well, I think, you know, we went over a lot of great information today, and I hope this was helpful. If, you know, sometimes I know we throw out these things and we kind of are trying to move fast to cover everything that we can. And if it feels overwhelming, you know what, we've got you covered for that too. We do something called a Visia, which is just like a skin analysis of your, that kind of gives you a rating or a ranking, if you will, for your skin, for things such as your texture, your pigment, your pore size, your fine lines, your brown spots, your red spots. And I think it's very useful when you're trying to start, or, you know, if you're thinking, I want to do something, but I'm not sure what, or where should I start my journey? And I think it can be humbling because it does give you a ranking against other women your age, but knowledge is power. And so if you kind of know what your issues are, it's so much easier to go ahead and then start that journey. And that's the thing that we love. I mean, I think it's so much fun to educate people about, you know, what's going on with their skin, and give them a game plan as, you know, to how to keep things looking, how to get you to where you want to be, how to keep it there. I think that's what makes it so much fun. And I know everyone at DCA and the Advanced Skincare Center and Kim and Bria especially are really great about giving guidance and help. So I hope this was useful. This noon Zoom was just about, again, the aesthetic treatments. On Monday, we will be going over skincare products, and that's going to be a really fun topic to cover. I really appreciate you guys spending time with us. I'm sorry if some of our audio visual was glitchy today. This is new for us. Again, that's my fault for being up here in Notre Dame with my daughter, but I just had to do it. I just didn't want to miss this special time with her. Be back on Monday. If you asked a question too and we didn't get to it, we'll get back to you as soon as we can via email. We are in the process of doing that, so apologize for those of you who have asked questions earlier in the week and we haven't gotten to you yet. We will. Don't forget that we are giving away over $25,000 in prizes this week. So enter for your noon Zoom prize today, which is a free treatment for anything that we've talked about today. And in fact, since we have two fantastic estheticians, I'm just gonna, and it's our 20th anniversary, let's just go ahead and double that and give away two. So make sure you enter. The way you enter, I believe is correct because I can't see the thing, but I think it's ASC Glow, is that correct?
Yes.
Okay, to 31996. Again, all capital letter, well, it doesn't make a difference, I guess, but ASC Glow, one word, to 31996. Or you can always send an email with ASC Glow as your subject to dca.marketing@dermatology-atlanta.com. Winners of all the noon Zoom prizes will be sent emails on October 20th. So that's when we'll announce them. Also, just by being here, you are entered into our 20th anniversary giveaway. That's going to be really fun. We have 20 amazing prizes that are waiting for you and a $1,000 gift certificate grand prize that will be good towards any of our skincare products or aesthetic services. Don't forget, October 20th is also our one-day skincare sale. So you can get all your information about what products to get on Monday and then go to the sale on Tuesday and save a bunch of money. So make sure you don't miss out on that. And if you're going to do that, please come early so that you can get one of our bonus gifts. They're limited and they are good for all orders over $100. So join us that day. And then don't forget, most importantly, that our 20% off customer appreciation gift certificate sale is ending soon. So if you are interested in these procedures, the nice thing about the gift certificate is if you're not really sure which one you want to do, but you know you want to do something, the gift certificate is good for any of our procedures. It's also good for products. You have a year to decide, and we're happy to help guide you and help you make good choices so that you get the results that you want. So again, we hope to see you on Monday. Thank you so much for joining us. And that's it. Thank you. Bye. Thank you, Kim. Thank you, Bria.